Guys, today let's learn about the Azygous system of veins and how it drains the posterior thoracic wall and the abdomen, the part of the abdomen, and how it connects the superior vena cava with the inferior vena cava. So let's start by drawing the superior and the inferior vena cava. So this is the superior vena cava, which is eventually going to divide. The superior vena cava will divide into the left and the right brachiocephalic veins. So, which is further going to give two branches. So the superior vena cava will divide into the left and the right brachiocephalic veins. The left and the right brachiocephalic vein drains into the superior vena cava, which further comes from the jugular veins right here, the left and the right jugular veins, and the left and the right jugular veins and the subclavian veins. This is the left subclavian vein and this is the right subclavian vein. So it all forms the superior vena cava right here in the front. Okay, now let's go down and redraw the inferior vena cava. This is the inferior vena cava. And this is the renal branches, the renal veins. The inferior vena cava divides into the two common iliac veins. So this is the two common iliac veins which eventually forms the inferior vena cava, and it will go up and drain into the heart. So the distance is for the sake of the study and to learn. Now let's see how the azygous vein is connecting the inferior vena cava with the superior vena cava. So let's draw the azygous vein. Okay, this is the azygous vein, the main azygous vein, which is on the posterior wall with the thoracic vertebra, and it gives off some branches. So first of all, it will give some intercostal branches. Let's see the intercostal branches. The posterior intercostal branches arising from the azygous vein. Okay, so the first intercostal branch will arise from here, the brachiocephalic vein, whereas the rest of the intercostal branches, the right posterior intercostal branches, will arise from the azygous vein. So right here is the first intercostal branch, the first posterior intercostal branch, and the second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, 11th, and there is no 12th posterior intercostal branch. This is called the subcostal vein. So this is the right subcostal vein. Let's write here the right subcostal vein, which is going to drain into the azygous vein. Okay, from below here, below this renal vein, this vein right here is the ascending lumbar vein. So the azygous vein is formed by the union of the ascending lumbar vein and the right subcostal vein. This is the right ascending lumbar vein. Okay, and the right ascending lumbar vein also gives off branches to the lumbar region. Okay, so the azygous vein is going to form by the union of the right subcostal vein and the right ascending lumbar vein. So these two will form the azygous vein, and this is the azygous vein. Now at the level of the T8 vertebra right here, just at the level of the T8th vertebra, two branches are going to arise from the azygous vein. First, let's look into this upper branch of the azygous vein just at the level of the T8 vertebra right here. So this branch arising from the azygous vein at the level of T8th vertebra is the accessory hemiazygous vein. So this accessory hemiazygous vein, this accessory hemiazygous vein is going to give the left posterior intercostal branches. Okay, so the um, fifth, sixth, seventh, and eighth left posterior intercostal branches is going to give off by the hemiazygous vein, which is arising from the from at the level of T8th vertebra from the azygous vein. What about the first four posterior left posterior intercostal branches? Let's go back to the brachiocephalic vein. Again, the first intercostal branch is going to arise from this brachiocephalic vein, and another branch is going to arise from this area, which will give off eventually the second, third, and the fourth posterior, the left posterior intercostal branches. Now, if we notice that the second, third, and the fourth posterior intercostal branches on both sides, the left and the right, are given off by a common vein, okay, are draining into the common vein. So this vein, which is going to give the left and the right, third, second, third, and fourth intercostal branches, is called the left superior intercostal vein and the right superior intercostal veins. So this left superior intercostal vein will give second, third, and fourth posterior intercostal branches on the left side, and the right superior intercostal vein, this is the right superior intercostal vein, will give the second, third, and fourth branches of the right side of the posterior intercostal arteries. Okay, now let's go down and see the other branch arising from the T8th vertebra. This right here is the branch which arise from the azygous vein at the level of T8th vertebra, and this is called the hemiazygous vein. This is the hemiazygous vein. and this hemiazygous vein will give off the remaining posterior intercostal branches. So the 9th, 10th, 11th, and not the 12th but the subcostal vein. So this is the 9th, 10th, 11th, and this is the left subcostal vein. Also from the on the right side, we saw that the right ascending lumbar vein and the right subcostal vein was forming the azygous vein. So the same will happen on this side also, on the left side too, that this left subcostal vein and this ascending lumbar vein on the left side the left ascending lumbar vein will form the hemiazygous vein on the left side. On the right side, the right subcostal vein and the right ascending lumbar vein will form the azygous vein, and on the left side, the left subcostal vein and the left ascending lumbar vein will form the hemiazygous vein right here. Also, the left ascending lumbar vein will give branches, the lumbar branches, okay, first, second, third, fourth, and the fifth, which arises from here, the common iliac artery, the common iliac vein, sorry. So this was the inferior vena cava, and this right here was the superior vena cava. Okay, let's zoom out. This was the superior vena cava and this was the inferior vena cava. Now inferior vena cava and the superior vena cava is connected by the azygous vein. Right here you can see they are connected from here with the azygous vein, and also the lumbar branches anastomose with this area of the inferior vena cava on both sides. This is pretty much everything about the azygous system of veins. Let's see some other things. Let's look into the other veins which I have not drawn here in this diagram. So the bronchial veins, the right and the left bronchial veins, they are the vessels which drain from the bronchi and the root of the lungs. So if we talk about the right bronchial veins, the right bronchial veins will drain into the azygous vein. The right bronchial veins will drain directly into the azygous vein. And if we talk about the left bronchial vein, so the left bronchial vein will drain into the left superior intercostal vein. Also, the lower part of the esophagus will also drain into the azygous vein. Okay, I will write O only for the esophagus. And also the mediastinal veins and the pericardial veins also drain into the azygous vein. The mediastinal veins and the pericardial veins will also drain into the azygous veins. Okay, now so if something happens, an obstruction happens in the superior vena cava just below this point. So for example, there's an obstruction right here. So the blood from the upper part of the body will go into the azygous vein, which will drain it into the inferior vena cava, and which will eventually go into the right atrium again. So this is all for now, and let's just do a quick review of what we have learned in this video. So the superior vena cava, and this is the inferior vena cava, and this is the azygous vein which connects the superior vena cava and the inferior vena cava, and from the azygous vein the right right posterior intercostal branches are arising, and one right superior intercostal branch is also arising, which gives off the second, third, and the fourth posterior intercostal branch. Also, from the left subclavian vein, there is the arising of the left superior intercostal vein, and from at the level of the T8th vertebra, the accessory hemiazygous vein and the hemiazygous vein will arise, which will give off the branches to the left side of the posterior intercostal branches. And the hemiazygous vein is formed by the union of the left ascending lumbar vein and the left subcostal vein, whereas the azygous vein is formed by the connecting of the right subcostal vein and the right ascending lumbar veins.